Hello, welcome to the Healthcare-Associated Infection Laboratory Identified Event Module for Long-Term Care Facilities, Clostridioid Difficile Infection Overview. I am your presenter, Kimberly Miller-Williamson, Infection Preventionist Contractor for the Division of Healthcare Quality Promotion, Centers for Disease Control and Prevention, Surveillance Branch. The learning objectives for this presentation are to demonstrate an understanding of laboratory identified or LabID event surveillance and reporting requirements for NHSN, explain Clostridioid difficile infection, CDI, definitions and protocols, define required monthly summary data for CDI reporting, and describe how to manually enter CDI LabID event data and monthly summary data into the NHSN application. Surveillance must occur for all resident care locations in the facility and cannot be limited to individual units or pods within the facility. Facilities must submit all positive C. difficile laboratory assays collected from a resident while he or she is physically housed in the reporting facility, including those that may be considered duplicate CDI events with positive laboratory assays, in addition to specimens collected during a brief outpatient visit. NHSN will remove the duplicate specimens from calculated rates. Additional surveillance and reporting rules include when submitting a LabID event for a specimen collected in an outpatient setting, the resident care location and primary resident service type should reflect the resident's primary LTCF location and service type on the day of the outpatient visit. Do not report a LabID event for a specimen collected prior to the resident's admission to your facility. Results from positive isolates collected as a part of active surveillance are excluded. There is not an option to perform surveillance on select or individual units or pods within the facility. An NHSN monthly reporting plan for the LTCF must be completed for each calendar month in which a facility plans to enter data. For each participating month, the facility must report numerators, which in this case would be CDI and/or MDRO LabID events, and summary or denominator data, such as total number of resident admission resident days. All alerts must be resolved for the month to ensure quality of your submitted data. We also recommend that facilities report for at least 6 consecutive months to provide meaningful measures. There are several reporting options in the LabID event module. Users have the option to report C. difficile as well as common multi-drug resistant organism LabID events. Within the module, users may elect to follow one or all of these organisms. I will now share a few key terms and definitions for C. diff. C. difficile positive laboratory assay, an unformed loose stool that tests positive for C. difficile toxin A or B, includes molecular assays, PCR, and/or toxin assays, or a toxin-producing C. difficile organism detected in an unformed loose stool by culture or other laboratory means. CDI laboratory identified LabID event. C. difficile positive laboratory assay collected while the resident is under the care of the reporting LTCF. Includes residents physically housed and cared for in the reporting LTCF and residents being cared for during a brief outpatient visit in which the resident returns to the reporting LTCF on the day of the outpatient visit or the following calendar day. Facility-wide inpatient or FAC-wide in, all resident care locations in the facility. LabID event date, the specimen collection date. Facilities should not submit specimens that are negative or collected during an admission in another healthcare facility. NHSN will categorize the CDI LabID events based on the specimen collection date to determine if each entered event meets the definition for a duplicate, incident, or recurrent event. A duplicate CDI LabID event is any CDI LabID event submitted by the reporting LTCF for the same resident in the facility following a previous CDI LabID event within the past 2 weeks. Duplicate CDI LabID events will be excluded from rate calculations. An incident CDI LabID event is either the first CDI LabID event ever submitted by the reporting LTCF for an individual resident in the facility, or a subsequent CDI LabID event submitted more than 56 days or 8 weeks after the most recent CDI LabID event reported by the LTCF for the individual resident. A recurrent CDI LabID event is any CDI LabID event submitted by the reporting LTCF more than 14 days or 2 weeks and less than 57 days or 8 weeks after the most recent CDI LabID event submitted by the reporting LTCF for an individual resident. Let's take a deeper look into these categorizations. For CDI LabID event data, NHSN has an algorithm built into the application to determine if the event meets the NHSN criteria for an LTCF onset event or a community onset event. All events categorized as community onset will be further categorized as acute care transfer LTCF onset or ACT low if the resident was recently transferred from an acute care facility. Community onset or CO is the date specimen collected 3 calendar days or less after current admission to the facility, for example, days 1, 2, or 3 of admission. Long-term care facility onset or LO is the date specimen collected more than 3 calendar days after current admission to the facility, for example, on or after day 4. LTCF onset low events are further subclassified as acute care transfer long-term care facility onset or ACT low, which is an LTCF onset LabID event with a specimen collection date 4 weeks or more following the date of last transfer from an acute care facility, for example, hospital, long-term acute care hospital, or acute inpatient rehab facility only. In this example, data entered in the NHSN application will analyze based on the following: date of current admission to facility, date specimen collected, and if the resident was transferred, date of last transfer. As previously mentioned, for community onset, the date specimen collected is 3 calendar days or less after current admission to the facility, for example, days 1, 2, or 3 of admission. Long-term care facility onset, the date specimen collected is more than 3 calendar days after current admission to the facility, for example, on or after day 4. LO events are further subclassified as acute care transfer long-term care facility onset or ACT low, which are LTCF onset LabID events with a specimen collection date 4 weeks or more following the date of last transfer from an acute care facility, for example, hospital, long-term acute care hospital, or acute inpatient rehab facility. Based on the events in the screenshot, you will be able to determine this event will be categorized as ACT low since the specimen was collected more than 3 days after the current admission date of January 8th, and since the resident was transferred from an acute care facility in the previous 4 weeks. There are analysis reports built into NHSN that will allow you to see a resident-level record of all entered LabID events and the NHSN assigned categorization. Here is an example of what you can expect to see. It is important to note that duplicate CDI LabID events will be excluded from rate calculations. Here is an example of a fictitious resident with multiple CDI LabID events entered in NHSN that simplifies NHSN categorization explanation. Incident: the first CDI LabID event ever submitted by the reporting LTCF. Duplicate: CDI LabID event reported within 2 weeks or less than 15 days. Recurrent: greater than 14 days and less than 57 days or 8 weeks. An incident: LabID event greater than 56 days after the most recent CDI LabID event. I will now discuss the monthly reporting plan to participate in HAI surveillance reporting for LabID events. The monthly reporting plan informs CDC and NHSN which modules a facility is following during a given month. Think of it as the facility's commitment to entering data for a chosen event for the month. This plan will inform CDC which data can be used for aggregate data analysis, such as developing a national baseline. A facility must enter a plan for every month in which surveillance and data submission will occur. A monthly reporting plan must be in place before events can be entered into NHSN for that calendar month. Plans can be modified retrospectively and can be entered for up to 1 year in advance. To enter a monthly reporting plan into the NHSN application, first select Reporting Plan and then Add from the left navigation bar. Select the month and year you plan to conduct surveillance and submit CDI data to NHSN. For LabID event reporting for CDI and/or MDROs, you will only complete the LabID event module section. Now we will cover how to submit a CDI event in the NHSN application. Before we proceed, I would like to share that the LabID event forms are available on the NHSN long-term care website. These forms are designed to collect the data that is required to be submitted to the NHSN application. If users decide to utilize the forms, one form should be used for each LabID event identified. Users may elect to print and use the forms. Both PDF and Word versions of these forms are available, and this allows users to customize the forms to better meet their needs. Even if customized, the NHSN protocols must be followed exactly. Every NHSN form has an accompanying table of instructions that gives detailed instructions for completion. To enter a CDI or other LabID event, from the home screen, users must click Event and then Add. As you see, users have the option to find events that have previously been entered into the NHSN application. One may elect this option to review a particular event or perhaps edit or make changes to an event that has been entered. Users can also review incomplete events, which will need to be addressed before data are considered as complete. For the purpose of this exercise, we will click Add to add a new event. Next, enter the resident information, being sure to complete every field with a red asterisk. A resident type must be selected as either short stay or long stay. A short stay resident is defined as being in the facility for 100 or less calendar days from the date of first admission into the facility. A long stay resident is defined as being in the facility for more than 100 calendar days from the date of first admission. Date of first admission to facility. If the resident leaves the facility and is away for 30 or more consecutive days, the date of first admission should be updated to the date of return to the facility. Select the date of first admission using the drop-down calendar. Date of current admission to facility. Date of current admission must be before the date of event. For example, a resident is transferred from your facility to an acute care facility on June 2, 2025, and returns on June 5, 2025. The current admission date would be June 5, 2025. 1 week later, the same resident goes to the emergency department for evaluation on June 12, 2025, and returns on June 13, 2025. The date of current admission stays June 5, 2025. Next, we will scroll down to the event information section. For event type, select LabID event. The date of event will be the date the specimen was collected. I want to point out that the event date or date specimen collected cannot occur before the current admission date. Next, select the specific organism type that you are submitting event data for. After selecting the specific organism type, the remainder of the page will populate the relevant questions. Since LabID event was selected as the event type, the next box requires the user to enter the specific organism type. This box will populate with all of the organism options available in the LabID event module. Since a CDI LabID event is being reported, the user must select C. difficile as the specific organism type. After selecting C. difficile, the next two boxes will pre-populate with the specimen body site system as digestion system, and specimen source as stool specimen. There are no other specimen source options when reporting C. difficile events into NHSN. The next box requires the user to enter the location of the resident at the time of specimen collection. The populated resident care locations are the locations the facility added during setup and should reflect all of the resident care locations in the facility. By entering the resident care location, the facility is able to monitor C. difficile trends in particular locations within the LTCF if they choose to do so. If the resident had a specimen collected in an outpatient setting and meets the previously discussed setting requirements, the selected resident care location should reflect the location of the resident immediately prior to leaving the LTCF to visit the outpatient setting. Resident care locations must be mapped or set up in the NHSN application before reporting events, since the event location will be selected during event reporting. Next, the user is required to select from a drop-down menu the single primary service that best represents the type of care the resident is receiving on the date the specimen was collected. The available service types are auto-populated with NHSN service types, which means they are not pre-set up by the facility. The drop-down options for resident care locations and primary service type options will be the same regardless of the event being entered into NHSN. For the next question, enter yes if the resident has been an inpatient of an acute care facility, for example, hospital, long-term acute care hospital, or acute inpatient rehab facility, and was directly admitted to your long-term care facility in the past 4 weeks. Otherwise, select no. If yes is selected, 2 additional required questions will populate for the user to answer. The date of last transfer from acute care to your facility, and was the resident on antibiotic therapy for this specific organism type at the time of transfer to your facility. Keep in mind that a resident visit to an ED or outpatient visit to a physician's office is excluded since these outpatient visits do not represent an actual inpatient admission into an acute care facility. As a reminder, this question will be used by the NHSN application to determine if the CDI LabID event should be categorized as acute care transfer, long-term care facility onset, or ACT low, if it is a long-term care facility onset event. Long-term care facility onset, or low, means the date specimen collected is more than 3 calendar days after current admission to the facility. For example, on or after day 4. Low events are further subclassified as acute care transfer long-term care facility onset, or ACT low, low LabID events with a specimen collection date 4 weeks or more following date of last transfer from an acute care facility. You will then need to answer the next question regarding antibiotic therapy for this specific organism at the time of transfer. If yes, the resident should be included in the admission count for treatment on the monthly summary form. As a surveillance measure, this will inform facilities of any CDI burden coming into their facility. If the resident is on antibiotic treatment for C. diff, you may see some of these common medications prescribed for treatment: vancomycin, fidaxomicin, metronidazole. The final question regarding documentation of previous evidence of infection or colonization with this specific organism type from a previously reported LabID event in any prior month is an auto-populated field and is based on prior month's LabID events. Yes or no will be auto-filled by the system only, depending on whether there is a prior LabID event entered for the same organism and the same resident in the prior month. This question cannot be edited by the user. The last 2 fields are optional and may be used for local or group use to customize or expand data collected by the LTCF. In the custom field section, up to 50 fields may be entered with date, numeric or alphanumeric information. The comments section is a place for users to add additional information about a particular event. Unlike the custom fields, which must be set up prior to use, comments can be added at the time the event data is being entered and is free text. Keep in mind that NHSN does not use the data entered in custom fields or comments for any analytic functions. This screenshot provides a look at a completed CDI LabID event. Once Save is selected, the event will be assigned an event number, and the user will receive a message at the top of the screen indicating the event has been created. Now we will review how to submit the CDI monthly summary data to NHSN. Here is an example of the monthly summary reporting form. This form is optional, but is available for use to document daily counts during the calendar month. At the end of the month, the daily counts are added and only the total or aggregate counts are entered into the NHSN application. Keep in mind, the required columns on this form will vary depending on which modules and events a facility is participating in. For example, the first column represents the number of residents, which is required for all modules and events. For each day of the month, the number of residents in the facility should be recorded. Do not include residents for whom a bed is being held, but are not actually present in the facility. The next column is for the number of residents with the urinary catheter. Complete only if the facility is performing urinary tract infection surveillance for this month. The next column is for the number of antibiotic starts for UTI indication. Again, complete only if you are performing urinary tract infection surveillance for this month. Next, for each day of the month, count and record the number of residents admitted to the facility. Include both new admissions and readmissions. This is used for LabID event reporting. In the last column, if the facility is performing LabID event reporting for C. difficile surveillance for this month, for each day of the month, count and record the number of residents who are receiving antibiotic therapy for C. difficile infection at the time of admission. Include both new and readmissions. It's important to point out that only the monthly total will be entered into the NHSN application. A total for each column should be calculated by summing the numbers recorded for each individual day of the month. Alternatively, if available, these monthly totals can be obtained from LTCF administrative data sources in place of performing daily counts. The total or aggregate counts or monthly summary data are then entered in the NHSN application. The monthly summary data input for MDRO and CDI LabID event reporting seeks the following: resident admissions, resident days, number of admissions on C. diff treatment, number of residents started on antibiotic treatment for C. difficile, report no events if applicable. As a reminder, all required summary data are identified by a red asterisk. Resident admissions is defined as the total number of residents admitted to the LTCF during the selected calendar month. Includes new admissions and readmissions. Important note, a readmission is defined as a resident that was out of the facility for more than 2 calendar days and then returned. Resident days are calculated each day of the month at the same time each day. At the end of the month, sum the daily counts and enter the total into NHSN. When resident days are available from electronic databases, for example, ADT, admission, discharge, transfer records, these sources may be used if the counts are not substantially different, plus or minus 5% from manually collected counts. If participating in CDI LabID event reporting, the facility will be required to enter the number of facility admissions who were on treatment for C. difficile. This metric allows you to analyze the overall CDI risk coming into your facility. By entering these data, you will have access to NHSN analysis reports for CDI treatment prevalence on admission. In the absence of CDI documentation, users are encouraged to consult with a physician or nurse to verify treatment for C. difficile, since these medications could be prescribed for other conditions. CDI treatment starts includes the number of residents started on antibiotic treatment. This includes all new CDI medication treatment orders, regardless if the resident had a positive C. difficile test or met NHSN CDI LabID event criteria, regardless of how many doses the resident received or how many days the resident was on the medication, and even if the resident did not complete the antibiotic or switched to a new antibiotic. If the resident was switched to a new antibiotic, include the first and new order in the count, so you would count as 2 new orders. Include only CDI medications that were started while the resident received care in your facility or by outside providers who saw the resident during a brief outpatient visit, when the resident returned to the reporting LTCF on the calendar day of the visit or the next calendar day, meaning that they were not admitted to another facility. Do not include new antibiotic orders written while the resident was admitted in another facility, even if the resident continued to take the antibiotic during admission or readmission back to your facility. The benefits for this data collection element include: this measure will allow providers to capture the number of residents started on antibiotic treatment for CDI that month based on clinical decisions, specifically residents without a positive C. difficile test. This process measure should provide data on clinically treated CDI in order to inform our understanding of CDI management practices and serve as a proxy for CDI burden in nursing homes. You will notice a check mark in each box under the organism or organisms the facility has included in the monthly reporting plan and is monitoring for the month. This particular facility has elected to only include CDI LabID events in the monthly reporting plan for the month. Please note, selections are based on the facility monthly reporting plan for the calendar month. Surveillance for CDI LabID events are limited to loose stool specimens. Surveillance for MDRO LabID events must include all specimen sources. As a data quality check, the NHSN application requires users to verify in the application if no events were reported for that month. For LabID events, the active boxes are dependent on which organism type the facility selected to report in the monthly reporting plan. Here, C. difficile is the only organism. If LabID events have already been reported during the month for the specific organism, the Report No Events box will be disabled, preventing it from being checked. Otherwise, it will have a red asterisk next to the box. Here is a screenshot of completed monthly summary data. Once saved, the user will receive a pop-up at the top of the screen indicating summary data created successfully. As previously mentioned, FACWIDE-in surveillance and reporting is required for LabID event participation. Please contact the NHSN Help Desk for any questions or concerns using the NHSN ServiceNow portal. If you do not have a SAMS login or are unable to access ServiceNow, you can email the NHSN Help Desk at nhsn@cdc.gov. Thank you.